Order! Order! You are an incorrigible delinquent at times. Behave yourself, man!
Staying with medical matters, the NHS could be heading into meltdown come winter with not enough doctors to treat patients.
Speaking exclusively to Sky News, the president of the Society of Acute Medicine warns that hospitals may not be able to cope once the cold weather arrives.
Here's our health correspondent, Thomas Moore.
Early morning and already the waiting room at Colchester's A&E is beginning to fill. Patient numbers have risen by 10% over the summer and staff are nervous about the coming winter, not just because more patients need care, but there aren't enough doctors to treat them.
There is clearly a challenge around filling vacant posts, particularly with junior doctors in training. We know that there are lots of gaps in rotas going into the winter, and it's a daily challenge that we have every day to make sure that the rotas are safe.
In an exclusive interview with Sky News, the president of the Society for Acute Medicine has warned this winter will be the toughest yet for the NHS, with doctors' strikes adding to pressure on an already overstretched system.
Across the UK, one could imagine that there would be small pockets of meltdown within individual hospitals, that we would see hospitals under such severe strain that they would not be able to cope. And if we get to a point where the whole system is seized up and we've got a flu epidemic and we've got problems with staffing, then we would be concerned that the system would become unsafe.
Some hospitals have already restricted access to their A&E units because of a shortage of doctors, and neighbouring hospitals will have to pick up the strain. There is the potential for a domino effect. Dr Holland said the government's wrong to push ahead with 7-day services when the NHS is already so stretched, and it's wrong to blame junior doctors for holding the plans back.
If you took your car into the garage to be fixed because the battery had gone, you wouldn't put petrol in the engine and hope for it to start. And that's basically what you're doing with junior doctors. You're saying, let's make one group of people work a bit harder at the weekend to make 7-day services work. That will not improve 7-day services. It's impossible without extra resources. It's to do with doctors, nurses, social workers, physiotherapists, occupational therapists. It's to do with the whole system. And unless you actually consider the whole system, it's not going to work.
The Health Secretary is adamant that junior doctors are the key to 7-day services, and NHS England said it's no secret that the NHS faces unprecedented pressures, particularly over winter periods. But we know from experience that our frontline staff provide an excellent service to meet these challenges. Patients like this 82-year-old in Colchester's A&E are yet to feel the effects of an overstretched service.
They're very good, they're very patient. I mean, they've always got time for you.
So about 50% of ambulances, that's normal overnight, isn't it?
Yeah.
That will change during the day.
Yeah.
But senior doctors warn hospitals are being pushed too far, and there can be no guarantees over patient safety. Thomas Moore, Sky News.
I've been getting